Hey, it's Scotty. So I had to take Gus to the vet today, or actually the eye specialist, because a few weeks back, actually probably over a month ago, he must have had some kind of hay poke. His eye seemed to be bothering him, and then it got really bad. It seems to have gotten a little bit better. Here you can see what it used to look like, and now here you can see what it is now. So it's definitely getting better. I've been giving him terramycin, but it was bad, and then it started to get worse, and now it's getting better again. I had to make my appointment well in advance, and I wanted to go and just see if there's anything that I can do to keep him on the path of healing and, hopefully make a full recovery with his eye. So we went to Eye Care for Animals, and here was the examination. So I wish I was filming just now, because the vet tech did this really cool procedure where she took this device. It's this thing right here, and it has these little things on it, and when you push the button, it shoots them at the eye. It's like boom, 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 and it pushes, and I guess it measures the eye pressure. That's what she said. And so it was actually does this little tapping, and Gus was very well behaved. Gus, what's on your nose? You need a spa day. So then now the doctor's gonna come in, and we're gonna see if we can figure out what happened, if there's some injury to the eye. So they stained Gus's eye so that they're able to see if there's any injury or any anomalies or things like that. So that's why his eye has the yellow gunk on it. And Gus was pretty well behaved. He did not like being held, and he did not like having these lights shined in his eyes, but overall he was pretty well behaved. So there was an injury which is causing some mineralization. She's going to give me a handout about the mineralization and a specific type of medicine that's not the drops that we have. So we'll check those out. Hi Gus. We just made it home. And I gotta give him a drop of this medication. It is called Editate Disodium. It's compounded. He needs to have 1 drop twice a day in his eye. Who are you smelling? You just peed, and now you're smelling your own pee. Come on, Gus. Just 1 drop. Did it go? Let me see. Did we get it in? Open. Okay, we got it. We got it. Yeah. Let it slosh around. And then he can continue to have the terramycin. But they said wait a few minutes in between. So we're going to wait a few minutes, and then we'll do the terramycin here. I want to thank Jamie Sue. She sent me, because this is my old terramycin, and you can't get it anymore sent to California, so she sent me some. So I'm fully stocked for the next emergency. Let's take some time while we're waiting to read this sheet. So what they said was, it looked like he had some kind of scratch. Let's see. So he had some kind of injury, and then as it heals, it forms this calcium. Corneal degeneration can affect 1 or both eyes, occurs in area of the cornea that have suffered a traumatic incident or chronic disease process. Corneal dystrophy and corneal degeneration can lead to corneal ulcers. And they said there was no ulcer. ocular infections and corneal scarring, vascularization arising from continuous sloughing of the mineral deposits. Severe cases can cause visual impairment. Well, hopefully not. The treatment, our goal in treating corneal dystrophy with topical medication is to improve the health of normal cells overlying the corneal minerals. We may also treat the disease through dietary management, low-fat, high-fiber diets. Some cases may be candidates for treatment with topical acid treatment, which help to dissolve the mineral. This treatment may be performed once or multiple times, is often effective in improving comfort, reducing the mineral, and preventing further ulcers. In cases of severe progression and discomfort, we can remove mineral deposits through superficial keratectomy, a surgery which the outer layer of the cornea or mineral is removed. Now, for dogs, maybe. I don't know for little guinea pig eyes. Although most corneal dystrophy patients do not require surgery, with pets who do, owners need to be aware of potential complications. Surgery can introduce complications, potential anesthetic risks, blah, blah, blah. So, we're hoping that these drops will help. So basically, to sum up, his eye was getting cloudy and it wasn't going away quickly. And I always say, if you do the treatment for an eye injury and it goes away quickly, then you don't have to worry. But if it sticks around, if it stays cloudy, or if they're still wincing or whatever, squinting, and so that's what was happening with Gus. But I was using the terramycin, and they said that's exactly what you wanted to do. It keeps the eye lubricated. So now I'm going to do the terramycin, which he also doesn't like. Here you go. And then you can go take a nap. Come on, open. Open. Gus. Did we get any? Get any in there? There we go. Just keep your eye lubricated. Okay, now you can take a nap. Maybe we'll give you a bath later. We can wash this stuff off. Okay. You were a very good patient. So I hope that gives you a little bit of insight into what you might do if your piggy has an eye injury, a hay poke or something, and it doesn't seem to be getting better. I am lucky that here we have a place called Eye Care for Animals. But if you look into corneal dystrophy, corneal degeneration, and maybe you mention to your vet editate disodium. It's an ophthalmic solution, which is different from another ophthalmic antibiotic solution that I was prescribed before. So this one's compounding, and I am guessing that it is a TCA, a topical acid treatment, that's going to help try to treat and dissolve some of these calcium deposits. Okay, Gus. Gus is ready to escape. You know, we all love Gus so much, and so we want to take care of him and make sure that we do the best we can for him. Okay, Gus. So, until next time, thanks for watching. Okay, let's go.